4 neurologic populations, including stroke, Parkinson's disease, spinal cord injury, traumatic brain injury, multiple sclerosis, current literature supports the use of moderate to high-intensity exercise training. Despite this evidence, however, it is unknown how frequently physical therapists are challenging patients to these intensities and how they are assessing intensity. So this research project evaluated intensity utilization by physical therapists when working with individuals with neurologic conditions. Other conditions that were touched on in our survey included TBI, Parkinson's, MS, and more. However, in this poster, we specifically discuss how physical therapists utilize and measured moderate and vigorous intensity training with patients post-stroke. So we hypothesize that a minimal amount of PTs and PTAs are measuring consistently to determine if they are working their patients to a moderate or high intensity during training, even if the individuals believe that patients with neurological conditions should be trained at moderate to high intensity. So our demographics include 136 respondents. Responses were analyzed for completeness. 105 PTs were analyzed for our study. PTAs were included in filling on our survey and in the study, but were not reported on due to the extremely low response rates from the PTAs. The majority of respondents had a DPT and 6 to 20 years of experience as a physical therapist, and respondents were largely current APTA members and board-certified clinical specialists. And our survey was designed and piloted and approved by University of Findlay's IRB.
We created a survey for this that was housed in SurveyMonkey, and then it was sent out via social media, the U.S. clinical site database, and national PT list servers. Our inclusion criteria for this included licensed PTs or PTAs who spent at least 20% of their practice working with patients with neurological conditions, and then those not meeting the inclusion criteria were excluded from our analysis. So in 2020, the APTA developed a clinical practice guideline strongly recommending the use of moderate to vigorous intensity training for individuals following stroke, traumatic brain injury, and spinal cord injury. We asked in our survey if respondents were aware of the CPG, and if so, had they implemented it into their current clinical practice. During this, we found that 76% of respondents had read the CPG, but only 53% of PTs are spending more than 50% of each treatment session at moderate to vigorous exercise intensities. Board-certified PTs were statistically more aware of the CPG compared to non-board-certified PTs. We further investigated the use of intensity during evaluation and treatment. Our findings indicated that only 28.5% of PTs spend more than half of their evaluation session at moderate to vigorous intensities, with only 6% of PTs challenging their patients to vigorous intensities for over half the evaluation. Our findings indicate that only 37% of PTs spend more than half of their treatment sessions at moderate to vigorous intensity, with only 16% of PTs challenging their patient to vigorous intensity for over half the treatment session. Our findings indicate that in spite of the majority of respondents indicating intensity assessment is essential during patient treatment, PTs are not consistently using quantitative measurements such as vital signs or heart rate max to measure intensity. While there was an overrepresentation of APTA membership and board certification specialists compared to the general population, the study results found no statistically significant differences between groups for intensity utilization at evaluation or treatment. However, study limitations did include a small sample size, overrepresentation of board certification members who were more aware of the CPG by a statistically significant amount, APTA membership, and respondents from the state of Ohio. Please let us know if you have any questions about our study. Thank you.